Good morning, everyone, or good evening, because here in Poland is evening now. Today it's a very important live stream to me and I think to others, because we will be speaking about medication with Psychiatrist. I'm so excited about this live stream because I know how important it is to speak out loud about therapy, about OCD, and also about medications, because there are so many myths, misconceptions in this area. So I'm so excited. Nice to see you here. Let me know, how are you doing today? You can join us. Oh, Lee is also here. Lee is not sleeping now. Hacks from Poland to Australia. Hi, everyone. How are you? Oh, thanks. I'm pretty good. Ups and downs, but in general, I'm fine. After all those amazing meetings in IOCDF conference, all those emotions, and now I'm here in Poland, and I still can't believe I was there. That was a really amazing experience for me. OCD is unfortunately still with me, coming with me to Poland. Hi, but I will kick my OCD's ass. I know it. And you can do it too. Mm, I will try to invite our today's guest. There is always problem with Instagram, but we have time. Let me know, how are you doing? Okay. Yeah, Jennifer is here with us, so I try to invite you, Jennifer, once again. Mm, okay, maybe this time. Yeah, I know, Erika, it's so stressful for you. I keep my fingers crossed. Oh,
Hi, does this
hi.
work? Can you
Hi,
hear
yeah,
me?
yeah, this time
Okay.
works.
Yeah.
Instagram always makes problem with connections, but now we've
Yeah.
got it, and I'm so, so happy. Give me a second for my earplugs.
Perfect. Yeah, for some reason it wasn't working on my computer, but it works on my phone, so we'll go with this.
Yeah, we've got this. Awesome. So nice to see you again.
Yeah, it's nice to see you too. Thanks for inviting me on.
Yeah, wait a second. Something. Oh, maybe now. Okay. Yeah, I'm so glad we met in Chicago. That was so
Yeah.
amazing time. And oh, maybe once again. Maybe we try without this. It will be
Okay.
better.
Yeah. Can you hear me okay?
Okay. Sorry. Maybe now.
Yeah. Can you?
Do you hear me or?
I hear you. Yeah. Is it me?
some problems, technical problems, but
Can you hear me?
yeah, I didn't hear you right now.
Can you hear me now?
Maybe now?
Now can you hear me?
Now, okay. Now
Okay.
it's perfect. Yeah.
Okay.
Okay. So once again, I'm so glad I met you in person in Chicago. That was so amazing experience for me. I'm glad you accept my invitation for this live stream, because I know how important it is to speak about OCD, about mental health, but also about medications, because there is a lot of misconceptions, a lot of myths in this area also. So thank you so much for being here.
Yeah, thank you so much for inviting me. I really appreciate it. Yeah, and I think this is such an important topic, and so I'm really happy to speak about it.
Yeah, and I'm also so excited, because this is I did so much live streams with therapists, but this is the first time when I make a live stream with Psychiatrist.
Yeah.
And I'm really happy to be here with you. So maybe, Jennifer, you can tell us a few words, who you are, what are you doing, and about maybe your experience, and then we can start with our topic.
Yeah, sure. Thanks so much. Yeah, so I actually, before I went to medical school, I worked doing ERP with patients. So I started in the therapy realm beforehand. I was also studying art, so had a little bit of a different background. Was really interested in the overlap between art and mental health and rumination and art making and how that relates to OCD. So then I ended up applying to medical school. I went to med school at Penn in Philadelphia, and then came back to Los Angeles to finish residency training at USC. And yeah, now I specialize in OCD, anxiety, OCD related disorders, and do med management and or ERP. So yeah.
So happy to be here once again. I'm really excited.
Thank you.
And yeah, and why this is so important to speak about, also about medications, because in my environment here in Poland, but I know in general in the world, is the problem about stigma, about OCD stigma, about misconceptions when we speak about therapy, about mental health disorders, but also is a huge misconception about meds, and so many people are afraid of taking meds, or in the opposite way, they're thinking that only meds can help them without therapy. And I know from my experience, when I for many years I lived with OCD without treatment, without meds, and then after my diagnosis, I was thinking that therapy is 99%, and I can do it only with therapy, and I don't want to take meds. And this can be also so harmful, because I think any single person is different, and any single diagnosis and related disorders or combined disorders can be so different, and that's why it's so important to speak about this.
Yeah, absolutely. Thank you for sharing all of that, and I completely agree. First, I'll just have a quick disclaimer that this isn't medical advice for anyone here listening, and always talk to your own doctor first. But
absolutely.
Yeah.
I'm not therapist,
So
Yeah.
we just want to break the
Exactly.
misconceptions. But first of all, speak with your therapist, with your psychiatrist, because we don't know every single situation of you, and yeah.
Yeah, yeah.
You
So
can start.
yeah, perfect. Yeah, so there's a lot of different things I can talk about here. I think the first is this idea of medication and or therapy. So if someone has like a very mild case of OCD, it's possible you could just do medications or therapy. But I think most of the time, the gold standard would really be both medications and therapy. And there's a few reasons for that. First, sometimes, exposures are really hard. They're designed to be hard, right?
Yeah.
And we want to make people, anxious and tolerate that anxiety. And sometimes just even starting therapy can be really hard without medication to help first. And
Agree.
sometimes the medication is used just to sort of make it so that you're able to engage in the therapy. And sometimes, you just need both. And it really depends on the person and how severe the OCD is. But I'd say in general, most of the people that I'm seeing would need some sort of combination of the two.
Yeah, absolutely agree. And I was in therapy 1 year, and I was 100% sure that I don't need any medications. And 1 week on holidays showed me that this is the time I should start with medications, because therapy was so hard for me, and those days were so tough. So we decided with my therapist to go to psychiatrist and starting with meds. Not so huge doses because my psychiatrist is really careful, but we both know that for OCD it's something different between, for example, OCD and depression.
Yeah.
When we speak about meds.
Yeah, absolutely. In OCD, you generally need much higher doses with medications, and it can be really tricky because oftentimes people who already have anxiety probably have anxiety about medications too, and probably have anxiety about, especially if you have health OCD or somatic OCD, when you start a medication, sometimes, normal adjustments that your body are making, you can really interpret it as like, is this a dangerous side effect? X, Y, and Z. And so you have to be really thoughtful and careful about, navigating that. And I think another area that can be tricky that you have to be really nuanced with is it's really important that you discuss all of the risks and benefits of medication before starting it, and so that your client or patient really understands the medication, why they're taking the medication, what the risks are, what the benefits are, and why it's your clinical recommendation that the benefits outweigh the risks. But of course, when you start talking about risks, that sounds really scary, and then people hear all these side effects and they're like, I don't want to do it. So you have to be really careful with how you educate the patients, because at the end of the day, not taking a medication if you have severe OCD is also a choice, and it also comes with risk, right? So living the way that you're living when it's so uncomfortable, you could say is also a risk that you're choosing. So there's pros and cons with both choices.
Yeah, absolutely. And that's why it's so important to have therapists and psychiatrists who we can trust. And this education is so important, because my psychiatrist told me everything about side effects, about doses, about any possibilities. And I was prepared for really hard 3 weeks when I was so anxious. My wife told me, Lucas, you were almost dead because you were lying in the bed the whole day. I had heart palpitations, and I really didn't have power for anything. But I knew this is something normal for my type of meds, and this is important because if I can just prescribe meds without educating people, it can be really, really tough when side effects hit.
Yeah, absolutely. And it's so important to talk about, you know, what the most common side effects are, and, you know, like how often that happens, you know, how long it takes to adjust to medications, because oftentimes some of the more common side effects are really just in the beginning. And I think one thing that is important, I think one of the more common things is having stomach upset and nausea and like discomfort in that area when you first start a medication. And there's actually a good reason for that. So most of the serotonin receptors that we have in our body are actually in our gut, not in our nervous system. So these medications work on serotonin. And so when you take these medications, because the majority of your serotonin receptors are actually in your gut, it takes a moment for your body to get used to it, and all that excess serotonin can cause those side effects. But after a couple weeks, your gut gets used to the excess serotonin and starts to habituate to it. That's why in general you start to see that the nausea and stomach upset tends to go away after the first couple of weeks.
Yeah. We have here one question, but I think the best way will be to answer all questions at the end, so we can So Zach, you have to wait for the end. And there are also so many I think so. One thing, I think I made mistake because after my psychiatrist educated me about side effects, I will take my box of meds and I've read all the side effects possibilities, and oh my gosh, yes. I feel this, and this, and it's good to be aware of that, but you know, for someone with OCD, oh my gosh, I had this suicidal thoughts or something like that. It can be also something that can make us decide to stop taking meds. And I knew that in my case, those side effects were pretty long, 3 to 4 weeks, but I knew I have to wait, and then boom, it's okay, I live, I'm okay.
Yeah, and sometimes a lot of, you know, the initial side effects that we're feeling, it's, you know, in someone who already has anxiety and OCD, oftentimes things are even more heightened because you're looking for it, right? Sometimes it can become part of the obsessions and compulsions, like scanning your body or checking your body. Am I having this side effect? Am I doing this? Am I, you know, checking your heart rate to make sure it feels fine? And so you have to be with someone really trained when you're starting medications, because you want to make sure that, you know, you're addressing the heightened OCD symptoms that probably are coming along with starting medications too. And it's really tricky in the beginning, and it's really tough. And so,
And Jennifer, I think it's also so important to educate our close ones, our family, because in my case, at the beginning, my wife didn't believe me that I felt like, you know, so anxious, and in 2 days or in 3 days from starting taking meds, I felt so bad, and that's why we should educate our close ones too.
Yeah, absolutely. If you know, if you're willing to have family engaged in treatment, I think it's so important, not only from the medication standpoint, but also from the family accommodation standpoint, and making sure that, you know, family isn't feeding into compulsive behaviors and things like that. But yeah, I completely agree. It heightened anxiety is certainly something that you see when you first start a medication, and depending on the person, you know, I if I have the time and space, I will start really slow.
Mm,
And you know, even if you know you're trying to get to a really high dose, it's okay to start at the lowest dose or even cut the lowest dose in half, and start from there. And then if you're having a lot of anxiety, sometimes I'll also prescribe, you know, an as needed medication like hydroxyzine or Atarax, something like that, to just take the edge off a little bit, that you can take as needed for anxiety, which works, you know,
mm,
pretty much right
yeah.
right when you need it. So that's another tool you can use too. But just having, you know, your family aware if they're engaged in treatment can really help too.
Yeah, and also we should be educate that not every type of SSRI will be 100% working for us. I think
Yes.
I've had a lot of luck that I'm on my first SSRI now, and it works. Maybe not 100% because I still have few side effects, but we can speak about this later. But this can be also irritating if you start taking meds. There are side effects 2 weeks, and then your psychiatrist decides to change meds, and next 2 weeks again, and probably I think my mom was on SSRIs, and the fourth SSRI will work properly for her.
Yeah. So that's a really, really important point that you're bringing up. SSRIs, you know, they're all in the same drug class. They're all selective serotonin reuptake inhibitors, but they are not all the same medication. And so I think oftentimes what happens is if you try one medication, like let's say Zoloft, and it didn't work for you or you had horrible side effects, oftentimes someone is more resistant or hesitant to try a different one
Mm,
because they're worried the same thing's going to happen again. And it's not to say that it might not, I don't know, but it's really important to understand that all SSRIs are uniquely different from each other. They work on slightly different receptors. Some of them are metabolized by slightly different enzymes. And I like to really use, when I'm talking to patients, exercise as a good analogy. So, for example, if let's say you're saying, I'm going to go exercise, right? If you decide to go for a run, or you decide to swim, or you decide to do yoga,
mm,
you're going to feel
yeah,
very differently, right? They're all exercise, but cardio is going to pump you up, yoga is going to calm you down. And different exercises work better for different people, right? And so, and some people like certain exercises more than others. And side effects, you know, you could think of side effects like what happens after you work out. Sometimes your biceps are sore, sometimes your core is sore, sometimes you just feel really
yeah,
tired. So it all sort of depends. Like you feel differently after each exercise. Also, the result is different. If you do a really intense exercise and you know you run several miles and your heart's beating really fast, you're going to feel differently than if you just do, you know, 5 minutes of walking, right? So that's all to say is if you tried running and you hated running, you probably wouldn't say, well, I'm never going to try swimming or yoga. It's
yeah,
just about finding the right exercise or right SSRI
mm,
that works best for you. So I think
yeah,
sometimes I like using analogies to sort of make it more tangible to people, I think, to understand that there really could be a difference on one versus the other. And I'm happy to talk about more reasons for that,
yeah.
but that's just sort of a broad overview. Yeah.
I really like this example. It shows how is the situation with SSRIs, and the same situation is in therapy. For someone, CBT is with ERP can be really, or is really helpful for the first time. But for someone can be mindfulness mixed with ERP or ACT or something like that. And
Yeah.
And
Yeah.
And there are so many misconceptions about meds, and the first thing I have in my head is, can SSRIs change our personality?
Yeah. So
Because you know, so many people are thinking in this way. Oh, it can change my personality. I will take SSRIs until my death or something like that. Or SSRIs are addictive, or you know what I mean.
Yeah, I want to address all of those. So yeah, the first one about SSRIs changing personality. So that's something, you know, I hear a lot as a concern with starting medications. I think, you know, one of the things, it is certainly possible for some people, they have a little bit of this emotional blunting, but I think sometimes what we have to ask ourselves is it that you were just so anxious and for the first time you're not anxious? So this is just what it feels like to not be anxious, and it's a new feeling.
Yeah, the same situation with caffeine. When you drink coffee, so the next few hours, coffee can change your personality? I don't think so. You feel
that's a
in
lovely
different way.
example. Yeah, and you feel differently doing different things. So yeah, I think, you know, you're trying to, you know, reduce that anxiety, and I think it can be a new sensation and a new feeling for a lot of people when they're so used to having such a heightened response to anything, or wondering about worst case scenarios all the time, or what if this, what if that. When they're suddenly not having that anymore, is that your personality's changed, or is it that your anxiety has sort of tampered down?
Yeah, and the same is with ERP. After therapy and after ERP, after mindfulness sessions, I I didn't ask my wife for reassurance, and she asked me, Lucas, maybe you don't care about our relationship. And I told her, no, this is how therapy works. I feel better, and that's why I don't ask for reassurance, because therapy works.
Yeah. So that's another example of
absolutely. Therapy doesn't change my personality, changed my life, and how I cope with intrusive thoughts. And the same thing is with meds. They help us to go through the really tough journey, but it doesn't mean that it changed our personality, because we feel better and we feel less anxious.
Yeah, definitely. And another thing I really want to talk about that you asked about is, well, two things. One about being on meds lifelong, and then two about getting addicted to medication. So for your first question, you know, it depends on if you're, you know, using SSRIs for depression or OCD. And just talking about OCD, since that's what we're talking about, in general, if it's like the first time trying meds, you don't have as severe of OCD, you know, one could say you're maybe just using the medications to sort of help you get to therapy. Therapy did wonders for you. You feel like, you know, you have all the tools you need. You might not need the meds anymore. That's totally fair. That happens for some people. And in that case, what you generally recommend is continuing the medications for at least a year after you found that max dose that works for you. And then it's a conversation with your doctor if you feel like you have the therapeutic tools to manage OCD about coming off of that. Having said that, what I find more often is, you know, OCD is chronic, and a lot of people, probably about half of people are, you know, research shows, are on SSRIs for at least 2 years. And then there's a certain number of people that can be on these medications lifelong. And I think what we have to ask ourselves is, when we think about that, why are we treating mental illnesses differently than physical illnesses, right? Like when you start a medication, like let's say you have diabetes or high blood pressure and you need to be on insulin or antihypertensives, we don't say, well, do I have to be on this lifelong? It's just sort of accepted like, hey, this is something I need. And so I think that kind of is wrapped up in some of the stigma of mental illness. And it's certainly not the case that everyone needs to be on these medications lifelong, but I think there's a lot of people that feel like it's a weakness to be, if you need to be on these medications more long term, when in reality, we don't feel that way about, other types of medical conditions, right? Like we would never tell someone that if they're, taking a blood pressure medication lifelong, oh, that's a weakness, maybe your blood pressure is high because you weren't exercising enough, which of course is ridiculous. And that's not maybe the reason, and maybe it's something else, but we don't think that way with other things. And so I think it's more of a question of why are we thinking that way when it comes to SSRIs?
Yeah, and this is really painful for people who are struggling with OCD and with any mental disorders, because this stigma that taking SSRI is weakness can stop people from starting taking SSRIs or from starting therapy, because therapy is weakness. I am so hard. I don't need therapy. So why do you need therapy? You have to, you're a man, or you have to be strong woman, and this is not the solution.
Yeah, for sure. And I think that one way to sort of reinterpret it for clients or patients is saying, it doesn't sound weak at all to me that you're considering medications. In fact, that shows me that you're really brave, because I can't think of anything more scary or stressful for someone who has anxiety to try something new that's going to affect their body in some way. And there's so much uncertainty with that. So that actually sounds like a brave thing to do, like you're willing to try something new that has a lot of uncertainty associated with it. So yeah, I think that's another way to sort of look at it.
And this is also when someone has a migraine or something like that, why they take meds for this? Because they are weak, or
exactly. If someone has a headache and they need a Tylenol, we're not going to say tough it out. Why did you take the Tylenol? We'll say, of course, take the Tylenol. And so I think that also goes into the next question you had asked about this idea of, a lot of times people say, well, am I going to get addicted to the SSRI? And I think it's really an interesting question that people ask that. And I want to talk about a few things, and why it's not addiction, and what addiction is, and why that's different from when starting medication. So addiction really involves, this maladaptive pattern where you're kind of craving a specific substance. There's this loss of control because you're using it too much. You can't cut it down even if people ask you. You build a tolerance to something. It's sort of this compulsive use that you're seeking out even though it's causing you harm. It's interfering with your daily life. And so that's very different than SSRIs. So for example, when you're thinking about an addictive substance like opioids, for example, you're craving this euphoria or this high. You're not getting like a high or a craving for SSRIs. You're not necessarily using, SSRIs in a compulsive way, or using it because there's this loss sense of control and you have to, there's a very prescribed regimen and you're taking it as scheduled. And, you're taking the medication so that you can enhance your functioning in social settings and, work settings. Whereas in addiction, you're taking it and it's really negatively impacting your ability to work and all of these things. I think the one similarity you could maybe say is there's withdrawal symptoms from both of them. Like, if you abruptly start a medication, you might feel a little bit different, but it's not that you're addicted to the medication. I would say it's more of a dependence. And I think to understand all the concepts of what I just said better, it's really good to use an analogy again, like blood pressure medication, right? So if you're taking an antihypertensive medication because you have high blood pressure, you're often taking that lifelong, right? You take it every day, just like for your blood pressure, just like you would an SSRI, but no one is saying, am I becoming addicted to the blood pressure medicine? No, but you do need it every day. And if you were to abruptly stop taking blood pressure medication, you will also feel a withdrawal side effect. Oftentimes, if you suddenly stop taking a high blood pressure medication, you get this rebound effect and your blood pressure shoots up way higher. So oftentimes with many meds, when you suddenly stop them, your body goes through a little bit of a change or a withdrawal. But no, there, there is a big difference between addiction and, dependence and relying on something to help us cope or get through things. So I think that that's a big thing. And I think we need to, again, ask ourselves, like, why are we so concerned and using the words addiction when it comes to psychiatric medications, but we're not using those words or having those concerns, for high blood pressure, headaches, diabetes, etc., right? And I think it comes back again to this stigmatization that with these medications for psych issues.
Yeah, absolutely agree with you. And I think the one thing here can be this, that people who take medications can be anxious of stopping taking them. So I can be maybe not addicted, but something like that, like addicted from being less anxious. You know what I mean?
Yeah.
You feel better with taking meds, and you're afraid of stopping taking them.
Yeah, and I think that makes a lot of sense, right? Like they've really helped you. And I, with anything, it's scary to come off of, medications. And, if I had chronic headaches and I was on a medication for migraine that I took preemptively to prevent migraines, if I suddenly stopped taking that would make me anxious. And if I abruptly stopped that, I'd also have withdrawal headaches. And so, it's not that we're addicted to these things. It's that we, rely on them because they make us feel better. But it's not that like really negative connotation of, using them in a maladaptive way. So I think it is a very separate thing than addiction.
Yeah. And maybe we can tell more about how long it takes to point that medication start working.
Yeah,
because it's also so important thing. It's not like this. I will take my meds now, and this is my first SSRI pill in my life, and tomorrow I will feel much better. It's not the thing.
Exactly. And that's, I think, another thing that's really hard to grasp, because oftentimes most medications that we're more commonly using, you take it when you need it and it helps you when you take it. SSRIs work in a different way, where it's really sort of working on these receptors throughout your body, changing your body's response to different neurotransmitters, and that takes time. And so what's really tough is that in the very beginning, the first few weeks, you're getting all side effects and no benefits. And so you've really just got to trudge through that. And then at a certain point, your body gets used to that. Most of the side effects go away after about 2 weeks or so. And then it really takes, for things like depression or more generalized anxiety, about 4 to 6, sometimes 8 weeks. But in OCD, I would say the guidelines say you really need a full, at least 12 weeks on any given dose to say you've given it a fair trial, and And I think the other thing to keep in mind is that it's not like overnight you just suddenly aren't anxious anymore. And it's not like you just, it's very gradual. So what tends to happen for a lot of people is all of a sudden, if they think about it, they're like, huh, that's weird. I wasn't anxious about that, but normally I would have been. So it's like slowly you're sort of saying to yourself, like, oh, that used to be something that caused me anxiety. I guess for some reason I didn't react that way as much anymore. And so it's sort of this gradual change that you see over the period of weeks. And that's why it can be really challenging and discouraging at the beginning. But I think if you really educate your patients and let them know, like, this is normal, you're not going to feel it right away, then they can expect that it is going to take that time.
Yeah, absolutely. And now also it's so important because, okay, meds will start working in maybe 12 weeks, but the huge misconception here is that, oh wow, I'm taking meds for 12 weeks or 2 months or 6 months, and I still have intrusive thoughts in my head. And this is also when we speak about therapy, because the thing is not to not having the thoughts, because this is not possible, this is impossible, but the possibility to not engage with them and with all what OCD is trying to tell us.
Yeah, I think that's a really, really great point. So the medications, we're not getting rid of the intrusive thoughts necessarily. We're changing how we respond and react and how much of our life it takes over when we have those intrusive thoughts, similar to therapy, like you said. And so we're hoping that when, uncomfortable thoughts pass through us, we're not spending as much time, on those thoughts. It's not getting to us as much in a negative way.
Yeah, absolutely. So maybe the next point we can speak about is how we change this situation. Yeah, I know we can speak about meds, we can educate people, we can educate our close ones. I created few memes about taking meds also, but what we can do more to change this situation, to feel less ashamed about taking meds, but also to educate society about these misconceptions, because I think it's a lot to do in this area.
Yeah, I mean, that's a great question. I don't know if I have a good answer, but I think the more we talk about it, the more we normalize it. When I talk to patients and clients, a lot of times people feel like I'm the only one, or like this is weird, and I'm like, no, I see this all the time. This is a very common thing we see, or SSRIs are one of the most commonly prescribed medications in the US. I don't know about in Poland, but so it's a very common medication. And so I think the more we talk about it, the more we normalize it, the more we talk about it and treat it in conversation the same way we do about things like insulin or beta blockers or aspirin. They're all things that can help us feel better. And I think the more we treat it just like any other medical problem, then the more we can help destigmatize it.
Yeah, and the more we're talking about it, we can also in this way educate therapists, specialists, because I can remember a few situations with my friends when therapists told him that for OCD help, and at the opposite way, psychiatrist told him that only meds, and that he should take meds as long as possible, and this is also so harmful, and we should educate not only society, but yeah, prescribers too. So Lee,
Yeah.
thank you. Education for prescribers is so important.
Yes, I really want to talk about that. Thank you for bringing that up, because I think medication and the approach you take with medications for OCD is so different than other, anxiety spectrum or depression. And it is something, like, as someone who's been through medical training, it is something that I feel like is oftentimes missed in medical training, I will say. And one of the big things that I've been working on, and actually had talked about at IOCDF when I was there, is trying to increase, like, in residency, like after medical school, we do a residency, increasing training for prescribers specifically about OCD. Because what happens a lot is I will see someone that comes to see me and they've said, I've been on all these meds, nothing's working. But when I look at the meds they've been on in the past, they have not been on any SSRIs to a therapeutic dose for OCD, or they stopped the trials too soon, or they tried a medication that I wouldn't necessarily consider first line for OCD. And OCD is it's different. It's not the same as everything else. And so it's not to say like it's anyone's fault, and I'm not putting blame on anyone, of course. But I think we want to make sure that you're seeing someone who really knows what they're looking at. And I see someone else. Yeah, the rate of misdiagnoses in OCD is so high. It takes on average about 10 years for someone to be accurately diagnosed. I've seen someone get misdiagnosed with schizophrenia or psychosis or things like that, because maybe if you don't realize that it's OCD, maybe someone could think, if I have a thought that if I don't touch this 10 times, my mom's gonna die in a car accident. Like, someone who's not as well trained might be like, well, that's psychotic, and it's like, no, that's not schizophrenia. That's intrusive thoughts related to harm, OCD, and things like that. So I think, and then we want to be careful, because if you get misdiagnosed, you might be put on a medication that's not used for OCD and might have unintentional side effects and consequences. I see someone mentioned being on Lamictal and Seroquel, and that's something that I've certainly seen as well, is getting misdiagnosed. And I think what's really important is there's this really great meta-analysis that was done that looked at misdiagnosis rates among different prescribers. And I think what they found was that in multiple different settings, so not just for psychiatrists in general, but also I want to see if I can pull up the specific data. Yeah, so for just, for most people, they're seeing their primary care doctors as the point of entry before psychiatrists, right? And in primary care settings, we don't often see as specialized as OCD. So about 50% of times, primary care providers are misdiagnosing OCD. And then the rate of misdiagnosed OCD among primary care providers for less common forms of OCD, so things like relationship OCD, pedophilia OCD, harm OCD, the misdiagnosis rates go up to 85%. Because I think in the mainstream media, when we think of OCD, people are thinking they like things in very specific order, or they need to wash their hands a lot of time, which are also very real parts of OCD, but it's not the only types of OCD. And when they look at even just mental health care professionals, up to 40% of people were misdiagnosing OCDs. So it really points to the fact that we need increased training for OCD, among all types of professionals, and mental health providers included too. And so, something I'm very passionate about trying to change.
It's so important, because from my experience, when I had first symptoms of OCD when I was about 10, but the really hard OCD episode I've had when I was 18, and I decided to tell my girlfriend that I have really terrible thoughts about her. And we decided to go to psychiatrist, and psychiatrist prescribed me SSRIs, and didn't tell me what I should do with this in the future. And I decided as 18 years old young boy that I will not taking this meds because I'm not crazy, you know, and that's why it's so important to educate also prescribers.
Yeah, absolutely. And you know, I don't want to put fault on any specific systems, but I think it's so true. Like even in medical training and, you know, I'm sure other types of training, we don't spend as much time as I think should be spent on specifically OCD. And so, yeah, I think that the more education we can put out there, the better, so that the delays in diagnosis, you know, people, because that's your life, right? 10 years without a diagnosis is it can be a huge chunk of your life, and you don't want to be living in misery for that long if there's, you know, people out there that can help you.
Yeah, and I think also important is when we speak about side effects, because so many side effects will disappear in first few weeks, but really often there are some side effects when we should decide with our psychiatrist what we have to do, or if we should change our meds, or if we can add some other meds to help us, because, you know, after 1 month, I had a huge side effect and I was really stressed about that, because I was sweating so hard that I was last year in mindfulness workshop, and that was 1 month after I started taking meds, and I should be at this workshop really mindful, and I was so sweat. All my shirt was so sweat because of this SSRI, and this workshop was for me so stressful because there were so many people, and I sit like that, you know. But my psychiatrist decided to add some other meds, and it helped. And this is also so important. We can't just stopping taking meds, or our prescriber should decide what we can do if those meds are working really good for our OCD, for our anxiety. Maybe first thing we can add some other meds before we change SSRI.
I'm really glad you brought that up, because that's very true. So sometimes, you know, the side effects that you can get from SSRIs, you know, don't necessarily go away right away, or they could be more prolonged, like the sweating you were talking about, or sometimes sexual side effects, things like that. And so there are other medications that sometimes you can add to help with those side effects. And so it's really important to have a good conversation with your prescriber, because if you're on a medication that is doing an amazing job for your OCD, you might want to consider staying on it and adding something like you just said to help with the side effects, versus if you're on a medication and you're not getting that much benefit and you're having side effects, then you might want to switch to something else. And so just knowing that there are other medications you can take that can help sort of counterbalance side effects sometimes. And so, you know, just making sure that if you're experiencing something, it's uncomfortable, talking to your doctor about it, and they might be able to offer you something.
Yeah, and also huge side effect can be in sexual area, I think. And so many people are afraid of taking meds because of this, because it can be a really huge problem. And I know this from my experience, because now we have to decide with my psychiatrist if we can make something else in this problem, with this problem, or I don't know, because, you know, now the really huge side effect, the only one I think, is problem with not possibility to ejaculate. And maybe for women, for my wife, it is a really good thing, because I can, you know what I mean. I can do it for so long without ejaculating, and okay. But after all, I am so tired that I decided, okay, not this time. And this can be also so stressful for people.
Yeah, no, I think, and I appreciate you being vulnerable and sharing your personal experiences. I think that for a lot of people, sometimes they experience, you know, sexual side effects, and it's something that, you know, is harder for people to bring up to their provider. So I think it's important that people ask their patients if they're experiencing those types of side effects, to normalize it, because I think a lot of people have a lot of shame and stigma about bringing it up on their own. And yeah, there are certainly medications. There's a lot of research showing that partial agonists at the serotonin receptor can be beneficial. And then also, so for example, sometimes people will add Boost Bar on, which can help. And then sometimes people will add low doses of Wellbutrin, which can help. There's some other options out there as well. But then sometimes it just might be, you know, changing medications, and it's all about a discussion about what's, you know, what it is that is risks, benefits, alternatives, with all the possibilities. So,
because education here is so important, because for people with OCD, we can have some intrusive thoughts. Okay, maybe it's something wrong with me or with my relationship. Why I can't this time? Maybe I'm not attractive to my partner, or my partner to me, and
so I can imagine
education,
relationship OCD, it can definitely play a role in that. And so, you know, navigating that is, you know, of course, individual and personalized, but if you're able to have like open discussions as much as you can with your provider and your partners. But I think that's all really important
that's why trust to your provider is so important, because I know I can share with my therapist and my psychiatrist all I'm going through, and this is important.
Yeah, and I think that's another thing too, is, you know, sometimes you might, you know, you have to find your right fit with psychiatrists or therapists, and sometimes you go to someone and it's not a good fit. Not that they're not a good therapist or psychiatrist, but it's just not a good fit. And I think sometimes when people have that experience the first time they go, they're more reluctant to try again with someone else. And just kind of knowing that there's a lot of different styles, a lot of different people out there, and just because you didn't click with one person doesn't mean that the next person you see is someone you might not click with either. You might actually find someone that is a good, someone you can collaborate really well with.
Yeah. Oh, wow. I'm so happy about this conversation. I think it will be really helpful for others, and maybe we can answer for some questions. I saw that. Yeah. I will check. The thing I am navigating is, how do we rely on medicine without simultaneously making us afraid of our symptoms?
So, sorry, the question is, how do we start medication without being afraid of like side effects, like the physical symptoms of the medication? Was that the question?
Zach, if you can tell us if you ask about symptoms of side effects, or symptoms of OCD.
Yeah, I mean, I do think, you know, the more, and this also kind of is another reason now that it's coming to my mind of why it's really important to find a provider that is trained in OCD, is because it's so important that you get education about medications, especially because you want to know what possible side effects are, that you're making an informed decision when you consent to take medications, that you understand the risks, the benefits, the alternatives. And so you want to ask your doctors questions, and as doctors, we're really happy to answer them. But we also have to be mindful, and I know this wasn't exactly the question, but are our clients asking us questions for information, or is it becoming a reassurance seeking compulsion? And so that's just another thing that you have to be mindful of, and because you also don't want to feed into that loop. So sometimes when I have patients, I know it feels really bad because, you know, we're trained to help people and want to make people feel good. But if someone asks me, like, you know, is X, Y, and Z, do you think I have like appendicitis or something like that, from a stomach pain after starting medication, and after, you know, examining and knowing that they don't, and I tell them that they don't, if they then ask me that like 4 more times, I'm not going to say,
Yeah.
you don't, you know, but some, you know, if you're not trained in OCD, you might keep providing that reassurance. Whereas, you know, you want to, you know, in other cases, maybe say, I don't, depending on your relationship, of course, like, I don't know, like maybe it is appendicitis, right? Like, and just tolerating that as an exposure. Yeah.
Yeah. What are your professional opinions on use of benzodiazepines for OCD?
So in general, I personally don't use benzos like first, second, etc. line unless there's some real indication. I think when we talk about worrying about becoming addicted to something, benzos are one of those things where we actually can get addicted, and they can be really hard to come off of once you start. And especially if you end up on benzos when you're older, there's a lot of, you know, pretty significant risks and mortality risk with that. So if I don't have to get involved with benzos, I don't. The only time I maybe would use benzos is if someone had like severe anxiety and I just prescribed like 3 tabs they could have in a month. And, you know, sometimes just knowing that they have it, if they need it, is enough. They don't actually even need to take it. Or, you know, maybe they have severe flying anxiety and, you know, it's okay, it's just on the plane and that's it. Like, there are certain situations, but in general, no, I would say I would try at least 2 SSRIs at a good therapeutic dose first. Then I would try, you know, getting on an SSRI and adding on like, you know, Abilify or Risperdal, or I might try tricyclics like clomipramine. You know, all of these things I would try before I would go down the benzo path.
Yeah. And I think also a big problem, because I am on I think the biggest Facebook group about OCD in Poland, and there are so many people asking what type of SSRI help you a lot or something like that. And I think places like Facebook groups or Instagram accounts are not the right place to ask for this, because there are so many different people and so many different possibilities. So I think the first point is to ask your therapist, ask your psychiatrist about possibilities, not asking people on Facebook groups or on social media.
Yeah, absolutely. Yeah, you know, it's always best to see a trained clinician and get medical advice from the right places too. Yeah.
Okay, Jennifer, thank you so much for today's live stream. I'm so happy, and I think at the end we can tell this, that taking medication is not weakness. This is strength to decide to taking care of ourselves, to fighting for a better life. And yeah.
Absolutely. Yeah, totally agree. And thank you so much for inviting me, and yeah, happy to be here. And
yeah, and maybe we will make next live stream in the future. I'm always so happy to speak about mental health so openly, and I'm sure that what we're doing can help maybe few people, but if it helps those few people, it's worth our time.
Absolutely. Yeah.
Thank you, Jennifer. Have an amazing day.
Yeah,
And
you too.
bye bye.